Esophageal atresia is a congenital condition where a baby is born with an abnormal connection between the esophagus and the stomach. Normally, the esophagus is a tube that connects the mouth to the stomach, allowing food to pass through during the process of eating. In infants with esophageal atresia, this tube does not develop properly, leading to a blocked esophagus or the presence of a gap that prevents food from reaching the stomach. Esophageal atresia often occurs alongside a condition called tracheoesophageal fistula. This is when the esophagus is improperly connected to the windpipe, or trachea, which can cause serious complications like aspiration, where food or liquid enters the lungs. This malformation typically occurs early during gestation, often around the 4th to 8th week of pregnancy, when the esophagus and trachea are still developing. The prevalence of esophageal atresia is approximately 1 in every 3,000 to 4,500 live births. It is a serious condition but is manageable with medical intervention. There are several types of esophageal atresia, categorized based on the specific outcomes of the malformation. The most common type is type C, where the upper esophagus ends in a blind pouch and connects to the trachea via a fistula. Typically, infants with this condition present with symptoms shortly after birth. Parents or caregivers might notice choking, coughing, or gagging, especially during feeding. Excessive frothy drooling, difficulty breathing, and signs of distress can also occur. Due to the severity of these symptoms, esophageal atresia is usually diagnosed shortly after birth, often during a newborn examination or upon attempting to feed the baby. Diagnosis can involve various imaging techniques. X-rays can help visualize the esophagus and any potential blockages, while specialized studies using contrast dyes may provide further insights. The presence of a tracheoesophageal fistula can also be assessed through these imaging methods. If an infant is diagnosed with esophageal atresia, the medical team will typically recommend immediate surgical intervention. Surgery is the primary treatment for esophageal atresia. The goal is to create a continuous esophagus by connecting the upper and lower segments. This procedure can be complex and may require additional surgeries if a fistula is present. In many cases, surgeons perform a primary anastomosis, where they directly connect the two ends of the esophagus. In some situations, however, staged surgeries may be required, especially if the esophageal segments are too far apart or if there are complications. Post-surgical care is crucial, and infants may require a few days to weeks in a hospital's neonatal intensive care unit. Throughout recovery, feeding may initially involve alternative methods, such as intravenous nutrition or feeding through a tube. As the baby heals, feeding plans will be adjusted carefully, allowing gradual reintroduction of oral feeding. Long-term outcomes for children who have undergone surgery for esophageal atresia vary but can be quite positive. Pediatricians generally monitor these children closely for potential complications, such as gastroesophageal reflux, strictures, or swallowing difficulties. Some children may require additional surgeries later in childhood or adolescence due to these complications. Lifestyle adaptations and ongoing medical follow-ups are essential for children with esophageal atresia. Regular visits to a healthcare provider can help ensure that any potential issues are identified and treated early. Additionally, parental education on recognizing signs of complications can significantly improve the child's quality of life. In conclusion, while esophageal atresia is a challenging diagnosis, with timely intervention and appropriate care, many infants go on to lead healthy, active lives. Advances in surgical techniques and post-operative care have dramatically improved outcomes for these children. Families facing this diagnosis can find support through specialized organizations and healthcare teams dedicated to pediatric care. Understanding this condition not only helps in managing it effectively but also raises awareness, ensuring that more families obtain the necessary resources and support.